Hello, my name is Hugh Sharp from Lalibela Charity Trust. My wife Catherine and I toured Ethiopia in 2003 and visited the town of Lalibela, the 12th century capital of Ethiopia. We've returned on an annual basis. Just a few words about Lalibela, situated at 2,600 metres with surrounding mountainous peaks of 3,500 to 4,000 metres, has a population of about 30,000. Its 13 12th century rock-hewn underground churches make it the second most important Christian pilgrimage site and second most popular tourist destination in Ethiopia. It is a UNESCO World Heritage Site. But get away from a tourist track, go a mile or two outside the town and you go back centuries. It's remote, barren, deforested. Highland people are very poor. Farming is subsistence, you eat what you grow, totally dependent on the harvests, which is totally dependent on the rains. 3 successive failed rainy seasons precipitated the 1985 famine in this area. 1 million people died. 15 months ago, we were approached to fund a new standalone, self-contained maternity unit in the grounds of Lalibela Hospital. Festival Medical Service money, together with the Clark Trust in Street and Lalibela Trust, is funding this project, which will open before the onset of the rainy season in June. We agreed to fund a maternity unit because health posts, mobile phones, ambulances and lower segment caesarean sections have transformed the emergency maternity services available to Highland women from basically nothing to life-saving obstetric care, which will significantly reduce maternal and newborn morbidity and mortality. In the past 25 years, Ethiopia has tried very hard to achieve Millennium Development Goals 4 and 5, namely to reduce maternal mortality by 3/4 and under 5 mortality by 2/3 from 1990 to 2015. Ethiopia's maternal mortality rate in 1990 was 1,250 per 100,000 deliveries, one of the highest in the developing world, but by 2013 had fallen to 353 per 100,000 deliveries. This is very impressive, but our experience in the Ethiopian Highlands is that very little had improved until the last few years. Indeed, many maternal deaths may well go unrecorded. Lalibela Hospital has about 40 beds with 4 to 5 medical officers serving a population catchment area of 300,000. Within that 300,000 area, there are 10 health centres staffed by nurses and midwives, no doctors, covering a population of 30,000. Within that 30,000 population, each health centre has 4 to 5 satellite health posts with responsibility for a population of 6 to 7,000. Health posts and Festival Medical Services has funded 5 are a crucial interface of the Ethiopian health system, for the first time bringing healthcare to this rural population. A health post is simply 3 to 4 rooms staffed by 2 female health extension workers who have just 12 months health training, and they visit the huts teaching nutrition, sanitation, hygiene and safe water. In the health posts, other than family planning and childhood vaccinations, they do antenatal care. It's very basic, but they know who is pregnant, they know the probable expected date of delivery, and they are the first receiver when problems arise. Good mobile phone coverage from health posts to health centres and hospitals now ensures a speedy response to emergencies. 8 4-wheel drive ambulances, specifically for pregnant mothers, are scattered over this catchment area and collect from health posts, health centres, or rendezvous at an agreed site. Finally, since 2014, there's been 24/7 availability of lower segment caesarean section at Lalibela Hospital. So thanks to Festival Medical Services, pregnant women in a 300,000 catchment area in the Highlands for the first time will now receive emergency obstetric care. Lalibela Hospital currently has 3 rooms for labour, delivery and postnatal. Antenatal women share the mixed-sex medical ward, lower segment caesarean section women the mixed-sex surgical ward, newborn babies the paediatric ward. It cannot cope with the expected increase of desperately ill, dehydrated, exhausted Highland women who've been in labour for 2 to 4 days, unable to deliver naturally, now arriving by ambulance. The new standalone, self-contained maternity unit is about the size of 2 tennis courts. The outpatient area has family planning, consultation, scanning, pharmacy and laboratory rooms. The inpatient sector has antenatal, postnatal, surgical postnatal, critical care maternal and critical care neonatal wards, plus a labour ward, delivery ward and its own operating theatre. The Ethiopian Minister of Health, who visited a few months ago, described this maternity unit as a flagship building for small hospitals. Thank you, Festival Medical Services. Thank you.